Zinc comes in more disguises than a Marvel superhero. Lozenges, tablets, creams, ointments, sprays, liquids, gummies, each claiming to be the most effective form for boosting your immune system, healing your skin, or somehow making your cold disappear before that awkward client meeting. But here's the real scoop. Not all zinc is created equal, and which form you use makes a big difference depending on whether you're fighting off a virus or trying to zap a zit. Let's start with a fan favorite during cold season: zinc lozenges. These aren't just minty metal discs your grandma swears by, they're actually backed by science. When used at the first sign of a cold, especially the ones made with zinc acetate or zinc gluconate, studies show they can shorten the duration of symptoms by about 30%, give or take. The reason they work? Localized release. The lozenge slowly dissolves in your mouth, bathing the upper respiratory tract, the nasal and oral mucosa, in ionic zinc, which can stop viruses like rhinoviruses from multiplying or binding to receptors. It's basically chemical crowd control for incoming pathogens. But not all lozenges are equal. The form of zinc matters a lot. Zinc acetate is considered top tier because it releases more free zinc ions, the active stuff your immune system actually uses. Zinc gluconate is a close second. Anything with flavor additives like citric acid, sorbitol, or mannitol can reduce effectiveness by binding zinc ions and making them less bioavailable. So that delicious orange-flavored zinc lozenge that tastes like a creamsicle? Probably doing less than you'd hope, except for making your breath citrus fresh. What about zinc tablets and capsules? These are your go-to for long-term systemic support, not immediate symptom relief. They're great for boosting baseline zinc levels, especially in people who are deficient due to age, chronic illness, poor diet, or plant-heavy eating habits. When absorbed through the gut, zinc supports immune function, hormone regulation, wound healing, brain health, you name it. But it takes time. If you're coming down with a cold, popping a zinc tablet is like mailing your immune system a strongly worded letter that arrives a week late. Still, for ongoing health, tablets, typically zinc picolinate, citrate, or sulfate, are useful. Just be sure not to overdo it. More than 40 milligrams per day on a regular basis without balancing copper can cause problems, and that's not the kind of boost you want. Now enter the topical forms: creams, ointments, gels, and pastes. Here's where zinc struts its stuff in the dermatology department. Zinc oxide is famous for sun protection, hello, ghost white so for noses, but it also plays a powerful role in treating acne, eczema, diaper rash, and wound healing. Topical zinc modulates inflammation, kills acne-causing bacteria, and promotes skin regeneration without the harshness of many conventional treatments. It's like a bouncer for your pores, polite but firm. Topicals are also a dream for people who can't tolerate oral zinc, nausea, anyone. No gastrointestinal drama, no copper interference, just straight to the skin action. However, topical absorption into the bloodstream is minimal, so you're not going to fix a systemic deficiency by slathering yourself in diaper cream. Tempting, but ineffective. So which form is best? Well, it depends on your mission. Trying to shorten a cold? Use zinc acetate lozenges within 24 to 48 hours of symptoms. Looking to support general health or fix a deficiency? Go with oral tablets or capsules. Just watch the dosage and duration. Battling acne, rashes, or wounds? Break out the topical creams and let zinc work its magic locally. And then there are sprays and liquids and powders and serums. But honestly, unless you're dealing with a toddler, difficulty swallowing, or some very niche skincare regimen, most of these are just creatively repackaged versions of the same active forms. The moral of the story? Zinc doesn't have to be confusing, but it is situational. Treat it like a tool, not a one-size-fits-all miracle. Lozenges are like the fire extinguisher, great in a crisis. Tablets are like the home security system, steady, preventive. And topicals? Think of them as your skin's personal repair crew, always on standby, ready with a first aid kit and zero side effects. So next time you reach for zinc, don't just ask if it works. Ask where it needs to work, because in the world of trace minerals, location is everything.